2, 3.
Hi, welcome to
episode 3 of BroCast.
And today we have a very special guest. Today we have world-renowned doctor, researcher, scientist, expert on COVID-19, often on CNN and MSNBC, Dr. Peter Hotez.
Thank you so much, Peter Hotez, for being on this podcast with us. So, all the grown-ups have been wanting answers for COVID-19. Now it's time to let the kids have a turn.
Well, that sounds great.
Yeah.
I'm honored to be on and look forward to answering all of your very important questions about COVID-19 or vaccines or anything else you guys feel like talking about.
Thank you.
That is very great. So, let's get started with these questions. First one, will we ever be done with masks?
I think we will, but not for a while. And the reason is because there's still a lot of COVID-19 transmission going on in the United States. So the number of new cases was at the high of around 70,000 new cases a day in the U.S. Now it's down to around 40,000 new cases a day, which is still the highest in the world. So a lot of transmission. Maybe as vaccines become available next year, everybody gets vaccinated, that will reduce the need for masks. But we still need masks for a period after that. So I would say, maybe by a year from now, we may not need masks as much, but it's going to be a gradual process.
Yeah.
Okay.
Could be a long time.
Yeah.
But, we got to wear them to protect ourselves.
Yeah.
Well, you wear masks for two reasons, right? One is if you have COVID-19, you don't know it because a lot of people, especially kids, can have COVID-19 and have no symptoms at all, not even fever or a cough or anything, but they're transmitting it. So you wear a mask to prevent you from transmitting it to others, and it'll also reduce the likelihood that you can get COVID-19. So there are lots of benefits for wearing masks, and protects you, your friends, your family, and especially your parents and your grandparents.
Yeah.
Yeah.
I've seen actually many kids that aren't wearing masks, which worries me.
Me too.
Yeah, the message hasn't gotten out as much as it should have.
Yeah.
Yeah.
So how many years do you think, or will everything be, well, I think maybe a year is what I'm hearing from when everything will go back.
I'm hopeful by the fall next year that I can't say life will be entirely back to normal, but it should be a lot more normal than it is now. Things are already a little better than they were to some extent, but it may get worse again before it gets better. So I think a year from now, life will be much better, and I think even now it's better than it was. But some of us are expecting another big wave of COVID as we head into later in the fall or the winter months, and especially also as schools are reopening. So get ready for that. That we may go. It may still be a pretty bumpy road.
Yeah. Also, I'm guessing with the flu season also.
We have flu coming up, and so that's going to happen. Make sure everybody gets their flu shot, and also not as many young and babies have gotten their measles vaccinations. So I'm worried about the possibility of measles. So we got a lot of work ahead of us.
Yeah.
Yeah. That is great to hear.
Well, not great.
Well, not great. We hope we could be done with COVID-19, but next question. So, people around the world, including the U.S. president, have mentioned that a vaccine will be out by the end of the year. It seems like you have not agreed with this. Do you still disagree with that, or is it now a possibility?
Well, I think we'll have, there may be some vaccine released by the end of the year. I think where I've been pushing back and disagreeing with the White House is the president has said we might have vaccine released by October ahead of the election, and I don't see that happening. So that's more of the
Yeah.
but by the end of the year is a possibility.
Yeah. A month may be too soon.
Yeah, that's right. Because the clinical trials are ongoing, and you have to get 2 doses of the vaccine for it to induce a potentially protective immune response. And it takes, and these clinical trials are 30,000 people, and it's just going to take a lot of time.
Yeah. And even if we have a vaccine by the end of the year, we don't know how well it will work, right?
Well, no vaccine will be released unless you know it's working. So I'm not so much worried about that. I'm just trying to stress the point that don't expect to have this by next month. That's
Yeah. And in these trials of vaccine testing, what goes on in those trials, and is it like tests on real people? And
so there's vaccine trials going on all over the world. So, for instance, in our labs, we've developed a new vaccine for COVID-19 also. It's a low-cost vaccine for global health, and now we're producing that vaccine in India. They have the ability to make more than 1 billion doses, which is amazing. So that's underway now in India, and then clinical trials for that will start. But in the U.S., there's 3 major clinical trials right now for what are called Operation Warp Speed vaccines. This is the name of the federal program. And those began at the beginning of August. And so those are large clinical trials with 30,000 people in them each. So 3 vaccines, 90,000 people. Huge trials done all over the country. And hopefully by the end of the year, the first couple of them, we may have some results on whether these vaccines actually work.
yeah, wow. So it definitely takes a long time in one trial and to do it and get it right.
That's right, and that's not, and you can't rush them. So we've got a lot of experience doing vaccine testing, so we know how to do this, and that's why it's really important that we don't let the White House meddle, and that's they've done that, unfortunately, in this administration. There's been sort of a tug and pull between the scientists and the people in the federal government.
Yeah. Yep. And in these states with low numbers, like, I know there are definitely lots of states with high numbers, but in the ones with lower numbers or that are okay, is it safe to go inside people's homes and or cars?
Well, that's a bit of a complicated question. Right now in Connecticut, there's not too much transmission compared to other parts of the country, but it may be going up again. So you still want to give a lot of thought to this. And first of all, it means wearing masks all the time if you are at a friend's house, or if you are in school, or if you are even outside in a large group of people. And I would say, to be really fair to your parents also, you want to let them know what you're doing. Because, for instance, let's say you go over a friend's house, and even though people are wearing masks, whatever you're doing, you want to know that family has also been pretty responsible in social distancing. So, you don't want to go over a friend's house and then find out after you get there that they just came back from a holiday in some place where there was a lot of COVID-19 transmission and they weren't wearing masks, right?
Yeah.
So you have to have what I call situational awareness, be aware of what you're doing, and it does require a certain level of vigilance.
Yeah, so it depends on the family you're with and what they've done.
That's right. Are you in school now, or you have in-person classes, or it's?
Yeah, we started today, actually.
What's that?
We started today, actually.
So you were in school?
Yeah, we I am in school 2 days a week, and Noah is in school every day for 2 hours.
And so how was it?
It felt pretty safe.
Uh-huh.
I mean, all the desks are very, very, very far apart,
Mm-hmm.
and we're all wearing masks the whole time except for lunch.
Right.
And I mean, I don't know how long it'll last, but
right.
I mean, I don't know if something happens and then we all have to go back to full distant learning.
That's right. Yeah, absolutely.
So, I mean, it's always a possibility to have that.
Yeah, that's definitely a possibility.
And actually, with school, in school we're having to switch classes, like, because we go to different classes with different teachers, and you sit in different desks. Is it okay to sit in those desks where another person has just sat in?
Well, they think the amount of transmission from contact is less than we thought, but it might be a good idea to wipe things down between classes. Are they recommending you do that?
Well, I know they aren't recommending it, but my grandma actually told me to bring wipes.
Yeah, it's a good idea.
Because you want to wipe down the desk and just make sure it's clean.
Right. Absolutely.
So we're moving on to the next question.
If you want.
Yeah. So, what is the likelihood of catching COVID on paper, and that someone has passed out, as well as any other objects? So, what do kids and teachers in school need to be most vigilant about?
I think the risk of pieces of paper passed around transmitting COVID is relatively small, relatively low. We know it's much more about droplet contact, aerosol contact from people close to you who aren't wearing masks. But, you still want to wash your hands frequently and try to avoid touching your face at all times.
Yeah.
Yeah. Especially in school, you don't want to touch your face a lot.
Right.
Yeah.
Because, I mean, it's all these kids, you don't know where they've been.
Yeah, and thankfully in some schools, kids get to take mask breaks where they can just go outside and take off their mask if they're socially distanced with the other kids.
Yeah.
Yeah, and I know I was at my orientation last week because they want to have an orientation for everything that's new, and so someone wasn't there and they were like, oh yeah, she was just in Florida, and I got really scared then.
Wow. Yeah.
I don't know if I want someone at my school who was just at Florida.
Yeah.
Who's in one of my classes.
Yeah, that might seem very, very, very scary for most people.
Yeah, I mean, Florida's scary right now. And for school, and just for people in general walking around and being out, what types of masks do you recommend, and how important is it of the type of mask that you have?
Well, they say the bandana type masks are not as good as some of the surgical masks. And, the school will have a list of approved type masks that you can use.
Yeah. I know we wear a bunch of like fabric ones and like reusable ones. And I mean, I think they're good. Is there like a specific type you would recommend, or a specific type that's the best?
Yeah, I mean there's a list, and what you can do is go to the CDC. There's a certain website that gives you the best types of masks, and let me get it for you. It's called Masks in Schools, and they give you specific recommendations on the different type of masks. And you should look at that. I'm see if I can find the link for you. I can send it to you, and then you have a way to disseminate that information.
Yeah, I can put that into the description of the podcast.
Okay.
Yeah, and in like my school, all teachers and the principal are telling the parents what the kids should bring. Like they tell parents to make their kids bring certain types of water bottles.
Mm-hmm. Well, yeah, because you want to bring water bottles from home, and rather than sharing, it's a good idea not to share water or utensils and that sort of thing.
Yeah. So
I this next question that Noah's going to ask, I feel like it's an obvious yes. I don't mean, it might be a no, but from my perspective, I feel like it's an obvious yes.
Yeah, same. I think it's an obvious yes too. If someone with COVID speaks over food or coughs on food, which I think is scary, and then you eat it, well, the person who's having that food, will you get COVID?
Not necessarily, but because there is COVID virus in droplets, and if you cough on, if let's say you're with somebody that has COVID,
Yeah.
the way you would get it is if somebody coughs, and those small droplets that you can't even see out your face, and then you rub it into your mouth or eyes. That's how flu is transmitted. But also, people with COVID are coughing into the environment, or when they're speaking, releasing droplets, then you can inhale it. So those are the two major modes of transmission for COVID-19.
Yeah.
So in the start of your sentence, you said like that no part. That was very surprising for me.
Well, he didn't say definitely no. It's a.
Well, those are the droplet contact and the respiratory contact are the two major modes. But if someone's not wearing a mask and coughing on food in front of you, you definitely want to get away from that person.
Yeah.
Yeah.
Yeah, I could see that.
Yeah, of course. Nobody wants COVID. So next question. What milestones must be reached for you to trust that a vaccine is ready for the general population? What are the risks of those milestones if those milestones are not reached prior to distribution?
Well, I think the one I worry about, any vaccine that goes through the full approval process by the U.S. Food and Drug Administration, they've got a great track record, and I feel really confident that everything's going to go really well with that vaccine. I'd be more than willing to take that vaccine and also give it to my family. If that process is affected in some way where we're doing something less than the full approval process, then let's have a discussion, because I would want to be able to see the actual data myself.
Yeah.
Yeah.
So you're saying that you feel good about this vaccine when it will come out?
If it gets approved.
Okay. Well, that's saying a lot coming from an expert.
Yeah.
So, I mean, I would take it if it gets approved then.
Yeah, you're Peter Hotez. You're super famous.
Well, thanks.
You're welcome.
And also in a state where the numbers are relatively low, if teachers, staff, and of course the students really follow all the safety rules, do you think school will be successful?
I think In places where there's not a lot of virus transmission and not a lot of COVID cases, I think the school semester will go fine. And the places where I worry are places like in Texas or Florida, where there's still a lot of virus transmission.
Yeah.
Yeah.
And like Florida and Texas, I could see how it could be a problem.
Yeah, and so like the street that I live on, very safe. So I'm happy about that. No coronavirus and no coronavirus in my street, of course.
Well, you may not know about it, so you shouldn't. So that's the whole point. So there could be people without any symptoms, and they could still have coronavirus.
Yeah, but so far,
I mean, you could have coronavirus and not even know it.
Yeah, but so far,
nothing you know of.
Yeah, so far, no probable.
You haven't heard of any cases.
Yeah, no cases that have been heard yet.
So, do you guys thinking differently now about maybe becoming a scientist or a doctor because of all this, or are your friends thinking about it? Are your friends thinking differently now about science than the way they used to think about it?
I've actually wanted to be a doctor for a few years.
Oh, really? You never told me that.
Because, like, of me being in the hospital.
Oh, yeah, but I didn't know you were interested in becoming a doctor. Well, that's good to know. So let me know when you're ready to start working in our labs. And
yeah, and plus
we'll have you come spend a summer in Houston.
Yeah, and plus we haven't been seeing each other a lot.
It'll be warm there.
Yeah, Houston's pretty hot. It's on the Gulf Coast.
Yeah.
Well, maybe you didn't know because we haven't been seeing each other a lot.
Well, now I live far away. Before, when I lived in Washington, it was a lot closer. But now, being in Houston, Texas. But you definitely have to visit Texas. Texas is very hipster.
Yeah.
Okay.
Now, Ross, you've been to Texas. You've been to Houston. You probably forgot, but you've been here, right?
Yeah, I was there a while ago.
Yeah, I remember. Your parents were down here, so we have to do a big family reunion sometime. So here in Texas, we have the world's biggest medical center. It's called the Texas Medical Center.
Was I even born then?
You should Google it while you're on. I mean, look, it's like a medical city.
What's it called?
It's called the Texas Medical Center.
Oh, he's looking right now. So, Texas Medical Center.
Let's see images.
Images.
Oh, wow, that's huge.
Oh, my.
Yeah.
Wow.
It's like a city.
We do everything big down here in Texas.
Yeah.
So, should we move on to the next question?
Okay.
Will COVID ever be like the flu, where we have a working vaccine, and because of that, we won't have to wear masks?
Say that again?
Will COVID ever be like the flu, where we have a working vaccine, and because of that, we won't have to wear masks?
Yes, I think that day will happen at some point, but it won't happen right away, even after the vaccines come out.
Yeah, because
it'll take time for transmission to go down, so people are still going to need masks.
Yeah, because every year, thousands of people have died from the flu.
Mm-hmm. Right.
Yeah, that's true.
Yeah. And right now, my brother is going to say the next question.
So, as we're getting closer to flu season, and I know the flu shots are actually coming out earlier this year. Is it too late? I mean, not too late. Currently, is it too early to get our flu shots?
No, now's the time to get them because there's already going to be starting flu transmission in September this month. So I just got my flu vaccine.
Oh, okay.
So now's the time to do it.
Yeah, because my grandparents, they just got their flu shots a couple days ago.
Mm-hmm.
So
That was wise.
yeah. So right now, last question in the podcast. In a state with low numbers, should kids not go near grandparents once they go back to school?
Ooh, that's a tough one. I was hoping you weren't going to ask that. I'm joking. I know I expected you were going to ask that, but that's the hardest question of all, right? Because grandparents want to see their grandkids, right? That's the best thing that happens to them.
Yeah, I mean, we have seen them.
The problem is this: with all the COVID-19 transmission, there is risk that kids are going to get COVID-19 in the school, and they won't even know that they have it.
Yeah, because every time I've been seeing them, I've been needing to get farther and farther away from them because they've been getting their haircuts for most of the time now.
No. Well, we've seen all our grandparents.
But so here's the way I would think through this, which is that because you're in school now, you basically have stopped your social distancing. I mean, you've stopped your ice. What's the word I want to use? Because you're in school now, you're no longer really socially distanced. And you're having contact potentially with COVID infected individuals, and you could actually have COVID and not even know it. So for that reason, you do not want to be near your grandparents. Now, what you could potentially do is once we have rapid tests available, let's say you were going to visit them over a weekend or they were going to come to the house. What you would want to be able to do is, because you could be infected with COVID and not realize it, is get tested. And so you want to get anytime you come into contact with older individuals, say over the age of 60 or 65, you want to get tested first to know that you're not infected.
Yeah.
And here's the problem. There's testing and then there's testing. So there's some tests where they're rapid tests, you can get the answer right away. There are other tests that can take 1 or 2 days, and that makes it really complicated. So you want to go to a place where you not only can get tested, but tested and get an answer right pretty quickly.
Yeah, but you also want it to be accurate.
That's right. You're absolutely right. So we don't have the system worked out as perfectly well as we'd like, right? The ideal test would be the following.
Yeah. I mean, I've heard that
you could take a strip of plastic, put it in your mouth, a saliva test, and then you get the answer right away.
Yeah.
That was a little
the best. And we will get to that point, but we're not quite there yet.
I mean, I've even heard that the tests that take a few days can be even not as accurate as we want them to be.
So
remember this. Let's say you get a test that does take a couple of days. All it really assures you of is that, and if it's negative, all it assures you of is that you did not have COVID 2 days ago.
Yeah, exactly.
So
it's like getting a 2-day-old weather report.
Yeah.
Yeah, so that plastic thing in mouth, that was a little disturbing for me to hear.
Yeah.
So again, if you're going to visit your grandparents, there has to be a pretty detailed discussion with your parents about, getting tested and when you're going to get the result back and what it means.
Yeah.
Yeah. So that was the last question.
Yeah.
There's a lot going on, and a lot going on with our vaccine, and there's a lot of suffering going on in the world right now, and
Yeah, it's a crazy world.
it makes me very worried. And so I hope that we can be in a position to make a contribution there.
Yeah.
Yeah, you never know what's gonna happen next. It's a very crazy world.
Every day is a surprise.
Yeah. Trust me, for me, literally every day. Big surprise.
Well, good. Well, have a great day, and I wish you great success in your podcast. And I hope it becomes one of the really famous podcasts, like a Joe Rogan podcast or one of those. And I bet it will be.
Thank you so much.
Yeah.
Okay. Have a good day.
Okay, thank you for joining us on BroCast today. We really appreciate it.
Yeah, thank you so much, and thanks for agreeing with us to let the kids have a chance to ask questions for COVID-19.
All right. All the best. Bye-bye.
Okay, thank you guys so much
For listening
to episode 3 of BroCast. Today was a very special day with our special guest, Dr. Peter Hotez.
Dr. Peter Hotez.
We hope all of your COVID questions were answered, and we hope this gave you more info on what is happening in the world right now, and we hope that it tells you a lot more of what's happening. And yeah, thank you for joining us today. We will be back next Friday with episode 4 of BroCast. And next week, it's not a special guest, but we have a yummy episode. Let's go with that.
Yes, and technically not a special guest, but special episode.
Yeah. Okay. So thank you guys for listening to episode 3 of BroCast.
We hope you liked it, and
we will see you back here for episode 4 of BroCast next Friday.
Yummy episode 4.
And also, just to let you know, we do now have an Instagram account. It's at brocast.rn. So thank you for listening. We'll be back next Friday. Bye.
Bye-bye.